How do I choose the right genetic test for my family? Deciding on the best genetic test for your family can feel overwhelming, but breaking it down makes it easier. Think about what health issues or conditions you want to learn about first. Start by understanding the different types of genetic tests. Chromosome studies look at the big picture, checking for changes in the structure or number of chromosomes. These are often used when a baby has birth defects or for certain cancers like leukemia. A common example is a karyotype test, which takes about a week and costs around $200 to $500. Single gene testing zooms in on one specific gene to see if it has mutations linked to a condition. This is helpful if your family has a history of a particular disorder, like cystic fibrosis or Huntington's disease. These tests usually take a few weeks and cost between $100 and $500. Genetic testing panels examine multiple genes at once, especially for conditions like breast or colon cancer. These panels can include 20 to 100 genes and take about 2 weeks. The price varies from $300 to $1,000, depending on how many genes are tested. Exome sequencing looks at all the parts of your genes that make proteins. It is often used when other tests haven't found answers or if a complex disorder is suspected. This test takes about 8 to 12 weeks and can cost around $2,000 to $5,000. Biochemical genetic tests measure the activity of proteins or enzymes, not the DNA directly. These are useful for diagnosing inherited metabolic disorders and usually involve blood or urine tests. Results are often ready in a few days to a week, and costs vary. Next, think about your family history. Talk with a healthcare provider or genetic counselor about any known conditions or mutations in your family. This helps decide if a targeted test makes sense or if broader testing is needed. If your family has a specific health concern, like a history of breast cancer, a single gene test or mutation analysis might be best. But if symptoms are unclear or could involve multiple genes, a multi-gene panel offers a wider view. If previous tests didn't give clear answers, or if you suspect a rare or complex condition, exome sequencing might be the right choice. For prenatal testing, chromosome studies or specific tests for fetal health can assess risks early. Consult a genetic counselor or doctor to interpret your family history and symptoms. They can explain what each test covers, its accuracy, and what the results might mean for your family. Consider the costs and whether your insurance covers the test. Some tests may require follow-up testing or counseling, so ask about that too. Carrier screening tests are also available to see if you carry genes for inherited conditions, which is important if you're planning a family. These tests can help you understand reproductive risks. Genetic testing can also identify risks for diseases that develop later in life, like certain cancers or heart conditions. Knowing this can help you take steps to prevent or manage health issues early. Remember, privacy matters. Talk about how your genetic information will be stored and who can access it. Emotional impacts are also important, so discuss how you might feel about the results beforehand. By understanding the different types of genetic tests and how they relate to your family's health history, you can choose the best option. Working with a healthcare professional ensures you get clear guidance and support throughout the process.